improve access to medications for patients with Parkinson's disease in Nigeria? Okay, I got it. Yeah, it's up. Okay, so making access to medicines a priority issue in Nigeria. I'll describe the challenges that we faced with regards to medicines access to Parkinson's medications in Nigeria, but also describe some of the ways we've tried to improve that situation. So Nigeria has a population of 182 million, and about 4% of that population is aged above 60. And that means that we have about 7.3 million people who are at increased risk of Parkinson's disease. We're also aware that the population in many of the developing countries is going to increase dramatically in the next few decades. So that means that we're going to have many more people with Parkinson's disease in countries such as Nigeria. The projected growth rate for persons with Parkinson's disease, this is from a publication in Neurology Journal in 2007, showed that Nigeria, for instance, would have about a 50 to 100% increase in the number of persons with PD come 2030. Now, one of the things that have motivated us is the Global Declaration on Parkinson's disease that makes it very clear that it's important that people with Parkinson's disease receive appropriate treatment and that we reform medical education in support of the WHO's Health for All initiative. One of the things that has plagued developing countries like Nigeria is the fact that we have the dual dilemma of communicable diseases, infectious diseases, and then we have populations that are obviously experiencing an increase in the number of non-communicable diseases such as Parkinson's disease. So the Global Declaration clearly indicates that world governments and all healthcare providers should take strong and decisive action in making PD a public health priority area. Now, what are the challenges in general that we faced in providing PD care in Nigeria? The first thing is definitely the competing health agenda. We also clearly have health systems inadequacies with our infrastructure, the manpower, the methods of healthcare financing, which is mainly private sector driven, and then peculiarities such as late presentation, delayed diagnosis, stigmatization, secrecy. One of the things is that people do not share their health problems with others, so having support groups is clearly difficult, and then the caregiver burden. But also the issue of medicine access. Availability is limited, affordability of the medicines is limited, and accessibility is limited. Having access to medicines is a multidimensional concept. It means that the medicines have to be available, they have to be acceptable in their quality, they have to be affordable to those who you're trying to get them to, and then they have to be accessible. The World Health Organization and the UN Development Group agree that access to medicines means that you have medicines that are continuously available and affordable at public or private health facilities or medicine outlets that are within 1 hour's walk from the homes of the population. And in developing countries, only about a third of the population has public sector essential medicine availability, and then only about 2/3 have private sector essential medicine availability. Now, this refers to medicines that are regarded as priority medicines. So the availability of medicines for diseases like Parkinson's disease are much less. So for instance, in the WHO Neurology Atlas 2004, drugs for PD were available to only 12.5% of those who need them in Africa. Prior to this presentation, I conducted an a survey of availability of anti-Parkinson medication in pharmacies in Lagos, Nigeria. Lagos is the commercial capital of Nigeria and has a population of about 20 million persons. And this is probably the best scenario, where we had a few medications available in July 2016, but most of the Parkinson disease medications are not available in public and private pharmacies. I also conducted a survey of practicing neurologists just to get a feel of what their concerns were and their experiences were regarding availability of PD medicines. And the questions were modified from the World Health Organization Global Medicine Survey. The experiences were that the majority of them had access to levodopa carbidopa 250-25, but only 12% had availability of the 125 formulation. Most other PD drugs were not available. The only other drugs that were available were the dopamine receptor agonist bromocriptine and trihexyphenidyl. And most of the patients had no health insurance whatsoever. Only about 5% had an access to health insurance. So what are our challenges? They're demographic. We have persistent obstacles to realizing full equitable access to medicines in developing countries, including Nigeria. And so how have we tried to tackle these challenges? The first thing that we recognized was that we have a competing agenda and priorities. So it became important to make PD a priority and give it a voice. The WHO has something that it calls the Essential Medicine List, and it acknowledges that the majority of low and middle income countries use that list to select medicines and are more likely to use these to limit procurement choices than our high-income countries. So the pre-existing WHO Essential Medicines List had listed just 2 medicines for the treatment, recommended 2 medicines for the treatment of Parkinson disease. One being piperidine, I don't know what that is, never used it, and the other is levodopa carbidopa, 110 and 250-25 formulations. So what did we do? The Movement Disorder Society has a task force on Africa, and we had discussed this at the task force level, and we wrote a strongly worded letter to the WHO. And what came out of that was that in the 2015 listing, the WHO has included the 125 formulation, which is better tolerated by patients, in the essential drug list. How that can help us is that governments can then use that as a reference point. We can also use that as a reference point to encourage pharmacies to bring in the medication. The other things that we've done is we had a drug donation pilot, which was a stopgap measure, but it was funded by Teva Canada, and they provided medications for almost 150 PD patients, lasted them between 9 months and 12 months. We have not been able to sustain that, but we've also gone into negotiations with pharmaceutical companies, hospital pharmacists, private pharmaceuticals, to make basic medications available for patients to purchase when they're prescribed. So these are pictures from our drug pilot scheme. We had 1,728 bottles of levodopa carbidopa, and that helped our patients. Our second obstacle is our health system inadequacy. So the trained manpower for neurology at present in Nigeria, we have 80 neurologists for a population of 82 million. And most of our patients present late. So how we've tackled that, our strategy was to establish a movement disorder clinic, train a more broad range of healthcare workers, and increase public awareness about Parkinson's disease. We've been able to establish that. We have a movement disorder clinic, the first in West Africa, established in January 2011. We've increased the numbers of patients with Parkinsonism attending the clinic. The total clinic population has gone up from 184 to 471, and of that 471, 254 have Parkinsonism. We've trained physicians. So in our medical school now, the University of Lagos, the undergraduate curriculum includes a lecture on Parkinsonism. The postgraduate internal medicine curriculum since 2001 also includes 2 lectures on Parkinsonism. The continuing professional development curriculum also has had an impact, and we've trained GPs, nurses, physiotherapists, and others on Parkinson's disease. In October, the Movement Disorder Society is sponsoring the first basic comprehensive course in Parkinson's disease and other movement disorders as our center. It's a 10-month course. We have 40 participants from neurology, internal medicine, family medicine, psychiatry, and medical officers, and we hope that they'll go out and train others. Our final strategy has been to increase public awareness about PD through the World Parkinson Day, TV interviews, engage policymakers, and then find advocates and partners. Our partnerships have been key. We have a dedicated workforce, and our management has also supported us extensively. Thank you.